Would you like to know how to get an abundance of emotionally charged, heartfelt video testimonials from your patients? How do you get those video testimonials? How do you get an abundance of them easily? That's exactly what we're going to cover in today's PPO Exit Live. Stay tuned. Three most common goals, the big picture goals of all of us, everybody in a general dental practice, and in fact, the specialties as well. Of course, our wheelhouse is general dentistry, but in all of the practices, because what I'm going to be sharing with you today is good for specialists, general dentists, any dental team members to use. The three goals. Number one, I already mentioned, and that is to help our patients achieve optimal lifetime dentistry. And we can say that, but actually doing that, there's a lot of obstacles in the way. One of the biggest ones is PPOs, and we'll touch on that a little bit later, but one of the biggest obstacles to helping your patients achieve optimal health is their PPO insurance. And the ironic part is patients think that PPO insurance is just wonderful because it allows them to go to the dentist because now I can afford to, since the PPO, it's just, I'm preaching to the choir, so I'm not going to go in depth there, but just know that PPO insurance is one of those things that is a roadblock to our goals. Number two goal would be professional success and satisfaction. Well, how do you achieve professional success and satisfaction if PPOs are driving a wedge in between you and the patients, between us and our patients? It's nearly impossible to achieve professional and really even personal satisfaction from dentistry to the level that you could. It doesn't mean you can't be happy and doing a good job and having some fun, but you never achieve that level that you really want to unless you're reducing your dependence on PPOs. And the third one is financial freedom. The third one is financial freedom. What does financial freedom mean? Real simple. It means that you work only if you want to, when you want to, and only with whom you choose to. So with the patients you want to treat, the types of the treatments you want to do, as much or as little as you choose, because financially you're not practicing because you need the money. That is really one of the ultimate goals of most, if not all, dental professionals. Maybe not all, but certainly 99.9% of the ones that I've worked with over the last 23 years would like to be in a position where the money isn't an issue at all because you've got enough money. Money is not an issue at all. When you're not money oriented, when you don't need the money, when you do not, patient's case is $50,000. True story. A guy named Jim, won't use his last name because of HIPAA. Guy named Jim sat down in my chair. Try to keep this story short. He basically said that his brother had just had his mouth rehabbed in Chicago, but now he had moved to the Boston area, so he was seeing me because he knew one of my patients, and I had done a nice job on her case. So it was a good referral, and he knew he needed a lot of work, and he sat down, and he basically said, can you tell me, how long would this take and what's it going to cost? And I basically, I made a big mistake. I said to him, I don't really have enough information yet. I mean, I need to do my x-rays, need to do, check your gum, need a photograph, I need all this information. And then I can, he said, no, I get it. He said, I know you don't know exactly. He said, but you took a quick look. He says, just a ballpark. I never should have said anything. But I said, I don't know, you could be talking about $35,000. Well, it turns out I was way off. It was $50,000 once we had actually worked up the case. So Isabel, my office manager in the Framingham office, she calls me back into the room. I'm like in the lab in between patients. She said, you need to go back in and talk to that guy. I said, what's the matter? She said, well, he's a little bit concerned that you told him maybe roughly 35. And when I put everything into the computer and we had worked it all up, it was $50,000. So I went in there. Super nice guy, very respectful, super nice guy, nice business suit. He owned a local company. He said, Doc, I know I told you I wouldn't hold you to it. He said, but I'm a businessman. He says, explain to me how $35,000 just turned into $50,000 20 minutes later. So I looked at him and I said, I appreciate the question. And I can certainly appreciate how you feel. But I got to tell you, I spoke out of turn. And the only mistake that I made is I shouldn't have given you a guesstimate because I didn't have enough information. I hope that we're going to see you again, and I'd love to help you out. Shook his hand and I walked out. I call that episode the $50,000 attitude. The attitude was I didn't need the money. Now, whether I needed it at that point in my life or not, let's say I did need it, you still need to approach every patient. They've got to feel that money is not an object for you, you don't need their money. When they sense that you need their money, they won't want to do the care. All right, so financial freedom was the third one. Let's get to testimonials. Let's jump right into that. So why are testimonials so important to our three goals? Well, because testimonials are social proof. Social proof, you've heard me talk many times about Robert Cialdini, the professor emeritus of psychology at Arizona State University. Social proof is when we have thousands and thousands of decisions to make every day, and we rely on what other people tell us, what other people felt, what other people did, and that's why reviews are so important. That's why having a 4.9 or 5-star rating is so important. That's why Trustpilot and BirdEye and Google reviews, that's why all of those things exist today, is because people make decisions on that. All right, so then why are we here if you could use Trustpilot and BirdEye and Google reviews and all that? Because you all are, and you should be. Those are all important. Those are fine. But those are short little blurbs. They're not from the heart, emotionally charged. Yeah, you might get a good one here or there, but mostly they're things like, a sentence or two saying how nice you guys were, or what a beautiful job you did, and that's all good. You should be doing that. I'm not saying don't. But this is entirely different, and this is way more powerful. So this is in addition to, not to replace what we just talked about. One of my mentors from many years ago, Dan Kennedy, and you want to get the visual of what he said here, because this has never left my head. And he didn't mean it literally, but the visual of this will stick in your head. If you got a pen, write this down. Dan said, when you show up to your sales presentation, which by the way in dentistry is you're presenting treatment. He says, when you show up to your sales presentation, he said you should walk into that room with a shoebox overflowing with testimonials. Letters and binders, and just you walking in with this box filled and overflowing, and they're falling out because there's so many of them. It's the abundance of proof. All right, so obviously we're not bringing in a shoebox, and they're not. We actually did handwritten ones and video ones, and when I say handwritten, we had our patients handwrite them, but chances are you're not going to go to that extent. So what I'm sharing with you today is how to get really quick, easy, heartfelt, emotionally charged video testimonials. All right, so how do you do that? I'm going to refer again to Dr. Robert Cialdini, because one of his principles of psychology and persuasion, which we get into a lot, is reciprocity. What is reciprocity? Well, reciprocity is in our DNA. We are wired for this. If somebody does something for us, we feel obligated. As part of our DNA, we feel obligated to do something back for them. So, and by the way, this isn't just person to person. Cialdini shows evidence, he cites evidence of entire countries third world countries who didn't have any money, who donated $50,000, $100,000 to an earthquake relief halfway across the world. And people, and I'm getting goosebumps even retelling that story, people say, well, how could they afford, this is a starving nation, how can they afford to give up $100,000 for earthquake relief halfway across the world? And Cialdini's researchers look back, and 30 or 40 years prior, that other country had done something for this country, and that's why. So it works on a national level, it works on an individual and a personal level. When should you ask for a testimonial? Write this down. You want to ask for testimonials at the patient's point of highest reciprocity. What is the point of highest reciprocity? Write this down. It's when they're gushing emotion and thanking you. It's when they're gushing emotion and expressing. It's when they're expressing a really deep appreciation. Now, I'm going to give you some examples, but it's not limited to these. It could be anything, big or even tiny. Doesn't matter what it is, but it's when they're really appreciative of what you did. You've got an emergency patient who called up this morning. You got them in within an hour. They sat down. You got them out of pain, and they've been in pain for 3 days. Doc, I can't believe you were able to do that quickly, and you also fit me into a busy schedule. This was amazing. Thank you. They're gushing emotion. They're appreciating. This is the best time to get a testimonial, right at that moment. How about when, let's say, you've got somebody who you did implants on and they haven't been able to chew for years. Their nutrition has been poor. They haven't been able to be in family photo. You've changed their life with the implants. And now they're looking at the implants and they're in and they're in tears or whatever. But when they're expressing appreciation for what you did, that's the time to get it. What about something as simple as an injection? Let's say you've got a phobic patient, a dental phobe, This is the first time in their memory that a doctor's ever given them an injection, and they didn't feel it. You know the type I'm talking about. When they're white knuckled on the chair, and they say, "Doc, go ahead. No, I'm ready. Go ahead." And my favorite thing always was, Bill, I already did it. We're all set. You're getting numb now. And they're like, "You just did an injection?" And they're incredulous, and they're so appreciative. So even at that, it could be a patient who you did something big on, something like veneers or a smile makeover or whatever it is. Anytime, write this down, anytime a patient expresses gratitude and appreciation for you guys, that's the time your immediate response should be, acknowledge what they said first. Don't just ask them for a testimonial. Acknowledge what they said. Terrific. I'm so happy for you that worked out so well. And yes, it is beautiful. And my goodness, this is, you just look so stunning. You look so confident, whatever. Or maybe you got them out of pain. We were happy to be able to do that for you. By the way, never say no problem. Maybe we'll get into that in more depth another time, but no problem indicates that it was no skin off your back and you would have done it for anybody, and they're not special. If you or your team are using the two words no problem, remove them from your vocabulary for the patient. All right, so two things. Your immediate response when they express their appreciation or gratitude, number one, is to acknowledge, so happy to do that for you. It turned out great. I'm so happy we were able to. You look wonderful, or I'm so glad you're out of pain. Whatever it was, acknowledge it, and then ask, and here are the words, write them down. Bob, would you be able to help us help another patient? Now, what do you think they're going to say right after they just told you how happy they are and how appreciative? They're going to say, well, yeah, what can I do? Every one of them will say, well, yeah, what can I do? Now, not every one of them will do the video, but I'm going to say about 95% will if you do it this way. So, point of highest reciprocity, acknowledge what they said, their appreciation, and then ask them, Bob, would you be able to help us help another patient? Well, yeah, how can I help? And pull out your phone. And it could be you, could be the doctor, could be a team member, could be hygienist, could be dental assistant, could be somebody at the front desk. Doesn't matter who or where you are in that practice. Everybody should be armed and ready to do this, armed with your phone and armed with that simple verbal skill. All right, so what do you say? You pull out the iPhone and just say, it would help so much if we were able to, if you could just repeat what you just said to me. I'm just going to, if it's okay with you, I'm just going to turn this on. And that way, the other patients in the future who are in your situation where they were on the fence or they weren't sure, or maybe they were afraid of the needle, or maybe they were thinking of getting implants, but they didn't know if they'd be able to really eat, whatever's appropriate for what they were saying to you, other patients who are in that situation where you were before you made the decision to move forward, it would be such a huge help to help them. And coming from you, and you're going to find 95% are going to say yes. Just turn on your video on the iPhone or your Droid and start shooting it. Now, is it better to have really nice high-end photographic equipment and a high-end DSL or mirrorless? Or yeah, I mean that's all good, but you don't need it. You just don't need it. So if you've got it already, great. But don't go spending money. Don't set up a studio. Take out the phone and shoot your videos. It's raw. It's rough. It's real. And just do it that way. All right, so if you're doing video, and I'm not an attorney, so you got to ask yours, but you want to have a release. You don't want to shoot a video and then realize you can't use it. So in the very beginning, what I would do, and you have to ask your attorney, but I would have the attorney write a one sentence thing that you can just read and just say, and again, this is not the wording, you got to check with your attorney, but something like, Betty, do I have your permission to use your image, your video, your words that you're saying, that you're sharing with me today in my marketing and to show other patients and online and so forth. And again, keep it short. They say yes, they're done. If your attorney wants you to have it in writing, you could have them sign it afterwards. But again, just make sure you're getting a release. Now, when you're getting that release, have your attorney including your name and where you're from. Why? Because you see all these testimonials that say JT or Bill S. or something. Nobody believes any of that. People think everybody made it up. All right, so video can be used as 3 different media. This is why I love video testimonials. You can use the video on your website. You can use the video in your ads. You can use the audio on your website or ads. You could use the audio on radio. You could use the written portion, and the written portion would be basically the transcript, and you'd remove the ums and the ahs and when they had to restart and say something again. So you'd only have the words that they said that would be meaningful, and you take out all the, well, should I say that again? Yeah, that kind of thing. So the transcript of it, you just pare it down to just the words that they said that were really helpful. But now you've got 3 different media, and you can use those everywhere as well. I would shoot them in varied settings, maybe some chairside, maybe some up the front desk, maybe some in a nice area where you have in there, maybe reception area, you have some plants or flowers. I'd go outside if the weather's nice and shoot some out front or in the parking lot. My point is you don't want them all to look exactly the same, so they'll all look a little bit different if they're just shot in different areas. But having an abundance of testimonials in your practice to show patients, and by the way, one of the best times to show them is when you're in the treatment room and you're presenting care. And Betty, you remind me so much of Mrs. Jones. She was about your age and she had lost all of her teeth and she was thinking of getting the all-in-4. Whatever it is that they're getting done, you then want to show them a short video blurb testimonial from one or more patients who had exactly that treatment done, because now it's social proof. And I tell you, this is only one of so many different ways that you can help get your patients to say yes to better care regardless of insurance. Even while you're still in PPOs, this is a huge thing to help you build your practice while you're still in the PPOs. Speaking of PPOs, your local colleagues, all the dentists close to you will tell you, your local dentist, they'll tell you can't reduce PPOs. And you certainly can't go, PPO 100% fee for service as I did in my practices. But even just reducing, you want to get rid of the one or two or three that you hate the most that are really killing you financially and just take up all your time. And they'll tell you can't. And the reason that they say that you can't, there's two reasons. Number one is because they don't know how to do it. If your local colleagues knew how to do it, they wouldn't be in PPOs. So the main reason doctors tell you can't do this, not in our area, you got to understand, we have too many of these plans, and we have the three big factories, and we have also the teachers union here. And so we're in an area where that might work. No, it'll work anywhere in the country. We've proven that over the last 23 years. After I did my two practices, we've proven it with 587 or more, because I think we're above that number now, practices throughout the United States. So you can do it exactly where you are. The other reason that they'll tell you that is my crabs in a bucket theory, which is basically if you put a bunch of crabs in a bucket and they all try to crawl out, the one that gets to the top first, the one below him grabs him and pulls him back down. So just know that in my Framingham practice, I was 100% free for service, and I had suffered with the loss of the PPO write-offs and all the rigmarole. And I finally built it to the point where I could do that. And I did the same thing with my dad's office. We dropped 13 of his 15 plans after he passed away, and he asked me to help take over that practice for my mom. If you type liberation, what my team will do, they're always watching for that, and what my team will do, one of our PPO experts, one of our basically PPO exit breakthrough coaches will reach out to you. It's a short conversation. There's nothing to sell in that conversation. It's maybe 10 minutes, but in 10 minutes, they'll ask you a few questions, and they'll be able to tell, is there a possibility that this is something where we might be able to help you reduce your dependence on PPOs safely? Basically on that call, it's called a PPO reduction call. What we do is after those questions, they'll know and they'll be able to map out specifically to your practice, what would those steps be? And that may be on a longer call after that. But the point is, in the 10-minute call, there's no charge. It's complimentary. It's super quick. You could do it literally while a patient's numbing or in between patients if you wanted to. So type liberation in there, and we'd be happy to have one of our folks, one of our experts reach out to you. Now, if you'd like to skip to the front of the line and you don't want to type it in and wait, just click on the link that's in the description below this video, and that will allow you to schedule your own. You jump right to the front of the line, and again, it's a 10-minute complimentary PPO reduction call, so you can schedule your own if you'd like. And if you're a general dentist, and again, I wish we could help everybody, but unfortunately, our wheelhouse, our expertise is helping general dentists reduce PPOs safely. So if you're a general dentist and you're the owner of your practice, use that link and schedule for yourself. Just wanted to say thank you for being part of PPO Exit and being really part of our No PPO movement, because my goodness, there's so much amazing stuff that we can do for our patients today in dentistry, and we want to take every advantage of helping them achieve optimal health and helping you guys build wealth for yourselves and for your family. So enjoy your weekend coming up. It's wonderful to have you with us, and thanks for being with us here on PPO Exit. Remember, you are only one gem away. Take care, guys.